HealthCare Community Connection is sponsored by UK HealthCare.
We are joined by Dr. Randolyn Barnett from the University of Kentucky Neuroscience Institute.
Yeah, that's right. She's here to highlight the work she does with kids at the Institute. Now, Dr. Barnett, what kind of patients do you see as a pediatric neurosurgeon?
Yeah, as a pediatric neurosurgeon, I take care of children from the time that they're diagnosed with an in utero condition, so even before they're born, all the way up to age 21. I take care of the breadth of pediatric neurosurgery, so I care for kids with things like hydrocephalus, cranial synostosis, congenital anomalies like tethered cord or spina bifida, Chiari malformations. I take care of kids with vascular disease, vascular malformations. And then my particular expertise is in pediatric brain tumors because I trained in fellowship. I was at Le Bonheur Children's and St. Jude Children's Research Hospital where we did the most pediatric brain tumors in the country.
In other words, she's smart, folks.
Yeah, exactly.
A lot smarter than Vasi or me. Yeah. I think you're okay with me saying that?
Yeah, no, 100%.
When it comes to the care for these patients, I know that it can take a lot of different routes, but in general, what does that care look like?
So I wanted to come back to Kentucky because I'm a Kentuckian. I'm from the 606, I'm from Breathitt County. I was very attuned to a lot of the struggles that our folks face, and I wanted to do something about that. So as a pediatric neurosurgeon, a lot of the work that my team and I have been doing in the last year is building comprehensive multidisciplinary programs where kids and their families can access multiple specialists at the same time. Instead of having to worry about going to different appointments on different days with different specialists and getting different opinions. We wanted to bring that care all together, especially for families who are driving multiple hours just to see us. And so one of the things I'm really proud of is the first clinic that we developed was our multidisciplinary brain tumor clinic at Dance Blue. I think a lot of folks know Dance Blue, but for those who don't, it's an organization at UK that raises a lot of money for not only research, but clinical care and resources for kids and their families who are battling a childhood cancer diagnosis. And so I have that clinic alongside two of our amazing pediatric oncologists, Dr. Danita Leitner and Dr. Senna Munikaisen, so we see all of those families and kids together. We also partner with Pediatric Brain Tumor Foundation, which also provides additional resources to families. We also started a multidisciplinary fetal clinic at KCH. That has been a partnership amongst multiple specialties in the hospital, including neonatology, pediatric surgery, neurology, myself, and multiple other pediatric subspecialties, where families who have kids with in utero diagnoses will meet their care team for their baby before baby is born. And parents, really get to understand what may happen to their baby once they're here. And that has been amazing for families. Another thing that we are currently working on, which is a huge goal of mine, is a comprehensive spina bifida clinic. Kids with spina bifida, they have very complex care needs and end up needing to see a multitude of specialists, including neurosurgery, orthopedic surgery, urology, and physical medicine and rehab. And Kentucky has not previously had that, and so that's something that we're working on, and our goal is to have that started by the beginning of year 2026.
Yeah, before we go to break, I want to ask one question. This is such a specialized field. Is there a big need for pediatric neurosurgeons?
There is a huge need. There are a little under 400 folks who've practiced pediatric neurosurgery here in the United States. So as you can imagine, over the course of the entire country, there's very few of us, and a lot of pediatric neurosurgeons tend to be centered in certain places. So there are care gaps. And here in Kentucky, I am the only pediatric neurosurgeon at UK. And I don't take that lightly. I really have a passion for taking care of kids here, and I want them to know that we are developing all of the ways and resources to take care of them, so they're not having to drive, outside of Kentucky to get care.
Yeah. So important. She's from the 606, but certainly a lot of folks are glad she's in the 859 as well. Dr. Randolyn Barnett, thank you so much for joining us for another UK HealthCare Community Connection. You saw information on your screen there if you'd like to learn more about this wonderful case.
Make sure, thanks so much for joining us.
Thank you.
Make sure to stay with us because we have more news after the break.